The Liberal government voted against a Conservative motion seeking parliamentary support for a new bitumen pipeline to BC, despite a recent agreement with Alberta which expressed support for such projects.
The federal Liberal government has spent over $1 billion on diversity, equity, and inclusion workshops for public servants since 2016, employing nearly 600 bureaucrats to push DEI in the public sector just last year.
Medical associations are applauding a federal initiative to fast-track permanent residency and increase immigration of healthcare professionals, but want to see further reforms to improve Canada's healthcare system. Hello, Canada. It's Wednesday, December 10th, and this is the True North Daily Brief. I'm Cosmin, Dzsurdzsa.
I'm Zoltan.
We've got you covered with all the news you need to know. Let's discuss the top stories of the day and the True North exclusives you won't hear anywhere else. The Liberal government voted against a Conservative motion on Tuesday that sought formal House of Commons support for a new bitumen pipeline to the British Columbia coast, despite signing a memorandum of understanding with Alberta. The non-binding motion mirrored key language from the Memorandum of Understanding Prime Minister Mark Carney and Alberta Premier Danielle Smith signed on November 27th. It calls on MPs to, quote, take note of the agreement and endorse construction of a pipeline capable of exporting at least 1 million barrels per day of low-emissions Alberta bitumen from a deepwater port on the BC coast. It also references the need for a, quote, appropriate adjustment to the Federal Oil Tanker Moratorium Act and affirms the duty to consult Indigenous people. During a Tuesday morning press conference, Energy Minister Tim Hodgson called the motion a, quote, cheap political stunt, so we will not be supporting the motion. Edmonton area Liberal MP Eleanor Olszewski echoed a similar sentiment at an earlier press conference.
As a party, we are united in wanting to make sure that we continue to build Canada, that we build it well, that we take into account climate change in the work that we do, and that we respect Indigenous rights holders. Our party is united on that. And so I won't accept that as a premise for that question. We are united.
You is dividing your own caucus. You don't think there's divisions over that?
No.
Conservative leader Pierre Poilievre, who has promoted the MOU as an opportunity to expand access to Asian markets, said on X that, quote, we need a new pipeline to the Pacific. He added that Tuesday's vote would allow MPs to decide whether to, quote, bring home jobs and put Canada first. Senior government officials speaking to CTV News on Background said the Conservatives' motion, quote, ignores critical elements of the MOU, including Alberta's commitment to negotiate an industrial carbon pricing agreement with a $130 per ton floor, Indigenous co-ownership opportunities, and engagement with British Columbia. So, Alex, the Liberals say they support building a pipeline, but here they are voting against actually putting that in a motion in the House of Commons. The Conservatives are definitely holding Mark Carney's feet to the fire, asking him to follow through on his commitments. But I think it needs to be made clear that an MOU is not, stakes in the ground, pipelines being built right away. It's a declaration that they're willing to work together with the Alberta government, but it doesn't necessarily mean that a pipeline is imminent. But as it stands, what would the MOU accomplish if the Liberals actually keep their word with Alberta and follow through on what they agreed to?
Well, in short, Cosmin, it would basically mean that we would, if they were to follow their word according to the MOU, it would mean that Alberta would be tied to a $130 per ton industrial carbon tax, largely in line with the rest of the country. And in return, Ottawa would support a pipeline being built through British Columbia, regardless of what Premier David Eby thinks, and to the West Coast, so that we can export oil to other markets. I think that it's important when zooming out on this pipeline drama to frame it against Canada's heavy reliance on the U.S. as essentially its only buyer for Alberta oil. Over 95% of our crude exports head south via pipelines, and that leaves us vulnerable to American whims, including those of the president when it comes to issues like cross-border tariffs. That's obviously squarely at odds with the Liberals' elbows up anti-Trump rhetoric that clinched their slim minority win last spring in the federal election. And that would be the hockey-inspired call to stand tough against U.S. bullying, popularized by figures like Mike Myers and echoed repeatedly in Carney's campaign. So in theory, the MOU could break that dependence by paving way for a pipeline to new Asian markets, and that would boost our leverage in potential trade negotiations. And aligning with that defiant narrative, of course, the Liberals voting down of this motion put forward by Pierre Poilievre shows that this MOU is likely just window dressing for the same Trudeau anti-energy policies that got us into this mess in the first place. Looks like another classic case of liberal flip-flopping. The federal government employed nearly 600 bureaucrats last year solely to push the liberal diversity, equity, and inclusion agenda, and the true numbers could be even higher because some departments failed to report on their so-called, quote, representation goals. Some of the federal government's largest employers, including the RCMP and the Departments of Health, Justice, Immigration, Natural Resources, and Public Works, declined to report their figures. Meanwhile, the Department of Foreign Affairs said there were too many to count. Read the inquiry, quote, the department manages an extensive network of 182 missions in 112 countries. It undertook an extensive preliminary search in order to determine the amount of information that would fall within the scope of the question and the amount of time that would be required to prepare a comprehensive response. According to the Immigration Department, providing the data was, quote, not possible in the time allotted. It said, quote, the department is committed to providing an inclusive, equitable, and respectful work environment for all. A staggering $1.049 billion has been spent by the government on diversity, equity, and inclusion programs since 2016, according to a previous inquiry of ministry tabled in the House of Commons in September. So Cosmin, DEI is almost like a state religion under the Liberal government. Other than DEI workshops for federal employees, are there any other examples of the federal government spending taxpayer dollars to push this ideology?
Yeah, Alex, absolutely. There's so many examples, it's hard to go through all of them, but it's clear that the DEI push that's being essentially handed down from the top down to the bureaucracy, because this is being pushed across all levels. Even when you look at the military, this goes way beyond just mandatory workshops and seminars as well that federal employees are dragged into. And I'm sure a lot of them go to these willingly from what we know about the public sector. But what we're seeing, especially under the Liberal government, is this full-blown DEI ecosystem made up of consulting firms, different businesses that peddle this like race-based identity stuff, and it's being funded directly by taxpayers. And there's loads of money, as you pointed out, being funneled to these companies, to these consultants, for very little value, because I have yet to see a single economic benefit presented why we need all of these training programs and what they're actually producing for the average Canadian in terms of making their life better. So the scope is honestly staggering. And as you mentioned, the federal government actually employed nearly 600 people just last year whose entire job was DEI. Not, accounting, not working, managing technological systems or delivering services to people. It was just DEI. And I think taxpayers are looking at this where there's 600 people employed and wondering, why are these jobs necessary? I mean, there's 600 jobs, full-time salaries and benefits that get paid. And if the government is serious about doing cuts, they should be looking at these first. But the actual number is probably higher because departments like RCMP, immigration, etc., just refuse to report their numbers. But as for actual projects, let's go through some of them. There was the National Defense Department that paid nearly $23,000 for a single Black History Month guest speaker. Fisheries and Oceans spent almost $50,000 for staff to attend a workshop on, quote, ethical space and engagement preparedness, whatever that means. Veterans Affairs paid $19,000 for the Kairos blanket exercise, which was dubbed as an Indigenous sensitivity workshop, where participants, I guess, stood on blankets. And then there was Industry Canada, which budgeted about $11,000 for a Black History Month project focused on, quote, freeing ourselves of imposter syndrome. So when people say DEI has become a kind of state religion or belief under the Liberals, they're talking about this senseless adherence to this ideology, no matter the economic cost. But it hides $1 billion bureaucratic structure and all of these consulting firms that are leeching off taxpayer dollars to sustain their existence. And honestly, without the Liberal government, I doubt many of these companies would be able to sustain themselves and operate. Medical associations are applauding the federal government for introducing permanent pathways and additional immigration nominations for internationally trained doctors, but are urging Ottawa to implement further healthcare reforms to secure the recruitment and retention of doctors in Canada. During a press conference in Toronto, Liberal Immigration Minister Lena Metlej-Diab, along with MP Maggie Chi, the parliamentary secretary to the health minister, announced the government would be creating a permanent residence pathway for internationally trained doctors who have at least 1 year of Canadian experience in their field, gained within the last 3 years, starting in 2026. Diab said the move is aimed at helping to fill gaps in Canada's healthcare labor market in a system in dire need of doctors.
It means that as we return to sustainable levels, we must simultaneously attract the high-skilled talent that will help relieve those pressures, particularly in key sectors like healthcare. We've heard a clear message from patients, provinces, and the medical community. We need more hands on deck.
A government release of the plan noted that in 2024, around 5.7 million, or 17% of Canadian adults, and 11% of children and youth reported not having a family doctor. A recent poll by Angus Reid Institute and the Canadian Cancer Society found that Canadians without a regular physician were more than twice as likely to struggle to book cancer screenings and non-emergency medical care. Over the last couple of months, Conservatives and healthcare professionals have raised concerns at House of Commons Health Committee meetings about internationally trained doctors already in Canada not being able to work due to limited training capacity and barriers to physicians obtaining credentials and licenses. You've had professionals and the opposition ringing the alarm about this for quite some time, but what are some of the reforms they've suggested that they want to see from the government to improve recruitment and even retention of medical professionals in Canada?
Yeah, so right now there are around, and this is a staggering number, 13,000 internationally trained physicians who are sidelined in Canada and unable to practice in their field due to red tape, as well as limited spots in the very few medical schools that Canada has. There's an old joke in Toronto where it says, if you want to find a doctor quickly, order a taxi, because there are so many doctors who are working as Uber drivers, Uber Eats drivers, and other professions or jobs that are far below what they're capable of doing in terms of helping Canada's healthcare system. The Canadian Medical Association president, Margot Bonnell, welcomes the move to get their skills to work sooner, but urges a, quote, concierge-style pathway with a single portal for exams, immigration, and background checks. They're also calling for a pan-Canadian licensure program to let doctors roam provinces. Interprovincial barriers also exist in the medical profession, where doctors have to be reapproved depending on which province they're going to. It's just an extra bureaucratic hurdle that slows down the process of doctors being able to provide care. Even though the issue is only tangentially related to the healthcare crisis that Canada finds itself in, tying immigration numbers to housing availability makes perfect sense from a quote unquote common sense conservative standpoint, but it would also ensure that Canada's population growth does not outpace our doctor supply and strain an already strained system even further, especially when you're already losing trained international doctors here due to bureaucracy and interprovincial barriers to providing care. So I would say stay tuned for updates on fixing our broken healthcare system.
That's it for today, folks. Thanks for tuning in. You can stay on top of new episodes every weekday by subscribing to the Daily Brief on iTunes and Spotify. Also, while you're at it, make sure to hit us with a 5-star rating and please leave a review.